All right. So today we were notified by Camp Ashland that there was an individual who had a mild cough. And as you heard Dr. Kaczynski say all along, who's from the CDC, we were planning to make sure that our threshold was low for what we would do if we had somebody with symptoms. And therefore, we've decided to move this individual to the quarantine center for testing at this time. So that's really out of a lot of caution, but that's what we said we would do, and we just want to do some testing and validate that everything is good to go. So, Mike, anything else you would add?
Only that the individual has very mild symptoms, is comfortable, was taken into quarantine unit and under our standard protocols, and really nothing out of the ordinary to report.
And I'm Captain Dana Hall. I'm coordinating the federal assets here. Our focus is to make sure we provide great services to all 57 people, and this was part of our plan, and we're collaborating with the University of Nebraska Medical Center and brought this individual in so that this person could get the testing they would need. So we await those results.
Are they here now?
Yes, they are.
What time did that happen?
45 minutes ago, maybe?
Around noon
An
sometime?
hour?
Yeah.
Is it a man or a woman? Do you know the age?
It's an adult female.
Is the testing underway, or has that test already been done and is being sent to Atlanta?
The samples have been collected, and it's my understanding that testing will be performed here.
Yeah, we have received approval from the CDC and did all the verification for the laboratory testing to be done here on site. So only if it needed confirmatory testing would it be sent to Atlanta.
What kind of procedures do you guys have to bring someone like that in that might possibly have this virus? I mean, how did you prepare the hospital?
Yeah, so it's not in the hospital. This is in our quarantine unit over in the Davis Global Center. It's the quarantine plan. So there's a lot of engineering controls there. So they're individual private rooms with negative air pressure, and we wore the CDC approved personal protective equipment as we did the assessment on the individual and collected the specimen just a short while ago.
And our quarantine team is here from the CDC, so we have our full team here, and our doctor is here as well, working with UNMC.
People may have seen footage of the biocontainment unit. They know what a hospital room looks like. Explain the difference between what this looks like compared to those two.
Sure. Well, this is really a lovely set of 20 rooms. Again, they have the engineering controls of negative pressure, so you want to keep the airflow in the room and not pushing out of the room, so that's the purpose of negative pressure. They've got the capability the individuals do to communicate, all the services that they may need as perhaps a hotel guest would. So really it's just a nice room with a few engineering features that make it safe.
Did this individual have family at Camp Ashland also?
Yes, and as soon as we do the second test tomorrow, I believe that's what CDC has guided us in, is that we'll do a second test tomorrow, and if that goes great, this person will be headed back out to camp.
What's their overall mood, kind of having to go through? Would be kind of traumatic for them.
Yeah.
She arrived and really was very comfortable, didn't appear to be anxious at all. We escorted her back to the room, did a quick intake. She was very cooperative and appreciated the care she received. Collected the samples, which caused a little bit of discomfort because it involves inserting a swab into the nasal pharynx and the oropharynx. Tolerated it well, and the samples were collected and sent to lab without any problems.
Is she running a fever?
No,
So the only symptom was a mild cough, is that it?
that's correct.
How long does it take to run the test?
Usually about 6 hours, we're told. And then I think our CDC physician, who's actually over in the unit at this time and was unable to join us, said that there'll be another test that we'll run tomorrow about 24 hours after this one.
And
Just
that's
to,
the protocol that
correct.
you use
Correct.
to repeat it.
Correct.
Sure.
Correct.
Thank Could you explain how the transportation took place?
Sure. So as we mentioned in the press briefing last week, we have had an ambulance out there. Midwest Medical Ambulance has been on scene in site to be able to quickly move anybody that needed to be moved. So we utilized that protocol. And they were brought here to the quarantine unit, and very smooth.
How likely is it that this person, obviously we've got all sorts of lovely bugs going around right now, and beautiful weather, how likely is this person to actually have this virus?
Yeah, I don't think we can speculate on that.
That's a difficult question. I mean, there are other viruses that are circulating in the community, and there's also other reasons why people have cough. So the assessment for the coronavirus is important, but it could be due to other causes.
So if this person does end up testing positive, what's the next step? Or does that then move to the population that's at Ashland? What would be the next step for that?
Yeah, so I would think, and of course I did ask this question of our CDC physician, that if, which is a big if, this is again out of a lot of caution to do this testing, if this would come back positive, then it's likely they would work with the individuals who are with this individual at a camp and perhaps extend their quarantine time, but not all of camp. So it would just impact the people closest to this individual.
Did this person come forward to you guys with the cough, or was it spotted by one of your staff?
Well, we screen everybody twice a day out at Camp Ashland, so this was part of our routine screening. And so it was presented this morning, and so that's why we're just finding out about this morning, because the symptom just happened now.
Is there a raised concern, I guess, with the patient out of Texas that was shared the same plane?
Well, I can speak a little bit for the CDC. The CDC, when I was with them, knows where all the passengers sat on the airplane, and so they have been following closely where people were sitting in contact with the person in Lackland who tested. But we're mostly focused on the Omaha mission, and so we're screening everyone here in Omaha twice a day, every day, with our CDC quarantine team and following our individual people here, and looking for symptoms in them.
On a daily basis, what kind of contact do staff or your folks or anybody else have? How are interactions handled, and what happens now that with the people who may have interacted on your staff with this individual?
Well, nothing changes. We're using all the personal protective equipment as recommended by the CDC. And meals are brought in every day, and activities are happening every day. We have a town hall meeting every day at 1:30. People can come to the town hall meeting if they like. We have the gym, and I know we've spoken about this some in previous interviews, but all that's unchanged. The activities are still the same, and our staff is still interacting with them throughout the day, all day.
And the process here will continue along the
Yeah.
same lines. There's a treadmill in the room for the person to use if they'd like to be more active. They'll receive the same screen that they received at Camp Ashland until the testing's available.
Yeah, really nothing's changed between either site. We're doing the same thing at both sites.
And our federal partners are going to maintain this as sort of an extension of their mission at Camp Ashland. So in all purposes, the CDC will be point actually in our quarantine unit, and we will be supporting them just like it is out at Camp Ashland, with wraparound services, linen support, other testing, of course, is one thing that's unique here.
So CDC will actually be staffing.
Correct.
Yes, we have our
We'll be
quarantine.
partnering to
Our
staff.
quarantine team is here in Ashland, and here we have doctors at both sites, and then our team is still here as well. All the ACF team, which is the social working team, the mental health team, all those teams are still in place.
Now that a person has been brought to Omaha for testing, what would you like the public to know if there is any health risk for the public?
I think I would say that we've been closely monitoring all these individuals. Again, this is only because of really having a very low threshold for any sort of symptom. Nothing will really change in that regard. We just still will encourage everyone out there to maintain their 6-foot spatial distance. People who interact with anyone will wear personal protective equipment, which has been in place since they arrived, for our federal partners, as well as some of our team cleaning rooms, et cetera. So none of that will really change.
And if the person is negative, they would go back to the camp, finish out the 14 days. If the person's positive, then they go to the big house.
I think that's a scenario that we're going to walk through a little bit. So, you think of somebody with such mild symptoms, would we instead allow them to still self-isolate in our quarantine space for a period of time? Because they probably wouldn't be somebody necessarily clinically that would require admission.
Captain Hall, maybe you could speak to this. I heard today the CDC kind of unveiled their surveillance facilities in California and up in Seattle and New York and stuff. How are you guys coordinating that, where you're monitoring it?
I could probably have Dr. Kozlowski answer that better for you, but we do have Dr. Kozlowski here, and he's speaking to the CDC every single day, and we're working very hard to make sure that everything we do here is consistent across all the sites. So we want to make sure that we're providing the best care, and we're fortunate to have Dr. Kozlowski and his quarantine team here for that.
And kind of sort of off topic, but today we also heard that there's over 1,000 medical workers in China that have been infected with this. What's your thoughts about that?
I don't have any information on that. I can't answer that.
Yeah, not only that we follow the CDC recommended personal protective equipment, and our protocols are set to protect the individual and the people who are caring for that individual, and it's things that we've trained for and that the quarantine unit is equipped to do in a safe way.
Correct. And we've just come off of well, not even quite off of a very significant influenza season, so a lot of the same practices and principles apply, so social distancing. And like Dr. Wadman said, we need to be mindful of anybody who is symptomatic, that we as healthcare workers take precautions that are necessary. So whether that's masking the patient, masking ourselves, using good hand hygiene and other techniques.
Just to clarify, is the testing being done then just at a Nebraska Medicine lab, or is that the Nebraska Public Health? what we also
Nebraska
call
Public
the-
Health Lab.
Okay.
And is there anything you can say about this individual, their hometown, where they were in China, anything?
No,
No.
I think they deserve their privacy in that regard.
Some viewers are still confused about coronavirus. If you can just kind of talk in general about, what are some of the symptoms, why is it so serious, and what can people do to protect themselves?
Well, the symptoms that we've heard has been primarily upper respiratory symptoms, sore throat, can develop into a cough and lower respiratory tract infection or pneumonia, and that's where the more sicker patients are experiencing those types of symptoms.
What can people do to protect themselves? Is there anything really?
They're the same types of things you would do for influenza, and staying away from people who are sick, and hand washing, that sort of thing that would prevent airborne transmission of a virus.
Maybe one last thing, is there any indication Camp Ashland or the Med Center will be preparing for a second wave of either people under observation or perhaps people for the quarantine unit that the American government's prepared to evacuate?
We don't know of any mission currently. To say that there wouldn't be any, I think we just don't know. But at this time, no.
So if this individual is found positive, again, hypothetical, what would be the next step? Would that person remain here and be treated, or would they go to another facility? How would that work?
Yeah, we would keep them here. So if their clinical symptoms progressed, we would admit them to the biocontainment unit, again, only if they're confirmed. And if their symptoms remain very mild, not even being worthy of a hospital admission, we would allow them to self-isolate in our quarantine space where we've currently got them.
Do we know whether this person, I know the CDC is tracing contacts with patient number 15 from Texas, who's in Texas. Do we know whether this person contact with that patient, that close to him? Anything, had the
I
tracing
don't-
turned up anything?
I don't know that information. I would have to address that to the CDC. But we're watching all 57 people, regardless of where they were sitting on the airplane, and doing that twice a day. So that standard would not change.
I know the CDC said this week they've been having some issues with the test kits that they sent out to certain states. Have you guys had any issues with the test kits you received?
We're told that our testing here has all been validated, so to the best of our knowledge, our testing will be appropriate and adequate. That's what we know to be true at this time. They may send out new kits, just given the issues, but at this time we feel good about the kits that we've received and have validated them.
How do you feel the last week has gone, I guess, in Camp Ashland?
I feel it's gone pretty well. I mean, it's been a great partnership. We have meetings every day at 1:30 with the residents, and they're always happy. There's things to do. They have like a Sega game station. They have a guitar now. So there's a gentleman playing for the children, playing music for the children. We've had several birthday parties. I think we had a birthday party, and then the one birthday party happened too early. They were a day early, so the one woman had 2 birthday parties. But there's been something fun happening every single day. Today they're actually searching for Valentine's hearts, and so it's just, we're entering day 9. We just finished day 8, so we're just starting into the 9th day, and morale remains high of staff and of the residents.
All of us who have been a part of the mission signed Valentine's in the Emergency Operations Center this morning to send out there, so that was fun.
Will this, if, again, hypothetical, if this does turn out to be positive, what will it do to, I guess, the quarantine days for everybody else?
Yeah, I did ask Dr. Kaczynski about that, and he said only those in his immediate family would probably have extension of their quarantine. Everyone else would continue to march forward, and we're on day 8 right now.
Does that make you hopeful, since we've only had one person showing some kind of symptom, flu symptom, and we've gone this far into the quarantine? Is this a hopeful sign?
Makes me hopeful.
I guess we're always hopeful people, but no, honestly, we're following all the 57 people, and we understand that each person's an individual, and then each individual is part of a family unit, trying to look at each person's needs and do the best we can for each and every person that's come to us for care.
And was there any kind of panic or worry when this person showed the symptoms among the other folks that are in that quarantine?
Not that I'm aware of.